Okay, hi y'all, welcome to my living room. This is continuing our stroke series of caring for a patient. Today is Tuesday, it is March 19th. You saw part 1 on Tuesday. You're going to be seeing this probably on Wednesday or even maybe on Thursday, depending on timing. And I'm getting ready for the speech therapist to come and work with my husband today. So, in the first part video, you guys learned what a stroke was. Now, what I did neglect to tell you is there are 3 different types of strokes. There are only 2 types. There's the blood clot, which is an ischemic stroke, and a burst blood vessel, which is a hemorrhagic stroke. And they're both serious. There are 3 levels of strokes. There's the TMI, which is considered a micro or a mini stroke. Now, a lot of people, as they get older, will have very, very minor strokes. Usually they're not problematic, and usually they don't have lasting effects. They're very, very small. They could knock a patient out for a few minutes. There are very little warning signs with them. They just need to be monitored by a physician. If you suspect somebody of having a mini stroke or a micro stroke, you still want to get them to the emergency room just to make sure that that's not a precursor to a much larger stroke. Then there's what they call a mild stroke. You know, mild strokes are strokes that affect the brain but are very mild. You are having very, very mild symptoms. Usually the patient makes a full recovery. Those also can be monitored by a primary physician to make sure that the stroke is not going to get worse, or it's not a precursor to having a secondary stroke. Now, the more severe strokes are the moderate to severe strokes, and those are the strokes that will put a patient in the hospital for a prolonged period of time. Now, my husband's classification of stroke is considered a mild stroke, even though he lost the ability to speak. The reason they classify that as mild and not severe is my husband still can walk around. He can do basic things. He can get dressed. He can take a shower. He can wash his body. He can take his medications. He can do all of that on his own. His stroke affected the speech center of his brain, which is about in this quadrant of the brain. And I'm going to kind of show you. And affected not only his speech, it also affected the right side of his body, where he has weakness with the right hand. He has difficulty concentrating and forming words. Now, the more severe strokes can render a patient on a ventilator. They can be totally incapacitated for a very long period of time. And the first thing as a caregiver to a stroke patient I would recommend is have somebody that can advocate for that person. Whether if you are the spouse of a stroke patient, have a good person and designate one person to be your speaker. That means that the person will speak on your behalf with the entire care team, home health team, and all follow-up doctor appointments. Now, if you're a single individual where you don't have a spouse or your spouse is no longer living or you're divorced, the next best thing is to designate one of your children if you have children. Now, if you don't have any of those, consult a good lawyer and figure out who you want to be your speaker, your advocate, in the event that you become incapacitated to where you cannot speak for yourself. And always consult a good lawyer who does living wills, and stuff like that, because those will help you in the steps. And I'm not going to get into that because that's a lot of out of my expertise levels. So always get good legal advice if you're in doubt. Now, the next thing is what happens after a patient has had a stroke and is being released from the hospital. Well, chances are, depending on how severe the stroke is, there are several options. One is to go to a rehab center inpatient. And usually the people that go to in-house rehab centers are the people that have had these severe strokes. They're more incapacitated. They need more around-the-clock care, and they need a lot of physical, occupational, and speech therapy. And we will get into the 3 different types of therapy as the series progresses. I don't want to keep these videos really, really long and confusing, but we'll get into what each specific therapy does for the patient and how to handle that. So, in my husband's case, and I'm going to use terms loosely because I don't want to give all of his medical background for his privacy and my sanity, I'm going to use him as the case since I'm dealing with a post-stroke patient. Before the patient gets discharged, they should have a plan in place for where the patient is going. Now, if the patient is fortunate enough to go home, they should be sending an entire home health care team from the hospital to do follow-up visits. Now, this will consist of a nursing person that will come and evaluate the patient, and then you'll have your occupational, your physical, and your speech therapy post-stroke. Now, this will be different in terms of if a patient has had a heart attack versus a stroke. You'll still get the nursing team. You may get the physical therapy team. You probably won't get occupation, and you won't get speech because those won't be needed in a heart attack situation. Speech is very, very important, and it's very, very important to start the 3 therapies as quickly as possible within the first couple of weeks of the patient going home. Now, you want to make sure that the patient is comfortable in their own home. Now, in my case, and I'm going to use my house in case, we have stairs. So, the one thing I wanted to make sure was, can my husband handle going up and down the stairs without too much support? And the answer was yes. They did a test at the hospital before they do that. So you always want to make sure you consult with physical therapy in the hospital before the patient is sent home. If you have stairs in your house, showers or bathtubs, if you have bathtubs or showers, make sure that the patient can get in and out of the bathtub safely. And you can make a list, and I would do this a couple of days before discharge. Just make a question list of things that are on your mind or are worrying you about bringing a patient into the house. Now, the hospital will send you home with whatever tools that they need for the patient in the house, whether it be a walker, a cane, medical devices. Does the patient need oxygen? Those will all be handled from the hospital and will be sent to the house. Now, Bob did not require any of that stuff, so we were very fortunate with that. The second thing you are going to want to do is write down all the phone numbers for the different departments, because you will be seeing many different doctors. Now, I'm going to broach a subject that actually happened with us, and that is what happens if your doctor is not affiliated with the hospital that you have taken the patient to. Now, in our case, the nearest hospital to us is not where our primary physician is out of. And it's very, very important that you get the hospital and the primary to speak if they're not affiliated with one another. It's very, very important that you make phone calls and make sure that they are communicating. Communication is going to be the key words to get the patient the full health care that they need and support. And that's very, very important. Make sure that you, as the advocate, contact the primary physician, let him know what's going on, let him know how to contact the hospital and vice versa. And they will work with your primary physician. Yes, hi, Lacey. So, that's going to conclude part 2. We're going to keep going with these series. Leave me a comment down below if you have any questions, or if you have any comments, leave them down below. We're going to continue the series. I'm going to do probably 2 videos per week moving forward. And we will get into post-care, what to expect, how does the patient recover at home, and how long is the recovery. And we will do that as the weeks go on. So, thank you guys so much for joining me. I look forward to talking more about post-stroke care on the next video. Have a great rest of your week, and I will see you on the next stroke care, post-stroke care for the patient. Okay, hi all. This is going to be a continuation of part 2's video on post-stroke care. And I had one of my viewers whose uncle was in the ICU for a stroke. Now, does every stroke end up being an ICU patient? The answer to that is no. My husband was never in the intensive care unit. It all depends on how severe the stroke is and what kind of support the patient requires. Some will require an ICU visit, some will require ventilators, some will require oxygen. In Bob's case, Bob did not require oxygen. He just required more nursing care and a monitor. And we'll get into the monitors later on because he's going to be fitted with one on Saturday. So, once the patient is discharged, whether it be to a rehab center or to the home, and we're going to focus more on the home than the rehab center since Bob has never been in a rehab center. Although we are trying to get him into what they call a day rehab center. And while we're on that subject, let's talk about rehab centers. There are 2 types. There's an inpatient rehab center, and then there's an outpatient rehab center. Now, inpatient, obviously, the patient will stay in an inpatient facility to get the care that they need, just to build up their strength enough so that they can get sent home and then they become an outpatient. Now, the outpatient centers usually will have a schedule where you will bring the patient on such and such day for so many hours, depending on the patient's need. And there will always be an evaluation done for the patient before they are assigned to a particular rehab center. Now, I'm jumping ahead on that, and I'll explain a little bit about that more as we go through the series. So, now that you've gotten your patient home, or the stroke patient's home, now what do you need to do? Well, the first thing is to make them as comfortable as possible. Have their favorite TV shows. Talk to them. They may not be able to communicate with you, but establishing communication, and it will be frustrating at the beginning. Believe me, I've gone through this, and we're going to talk about both the patient as well as the caregiver, because the caregiver also needs to make sure that they are taking care of themselves and not going crazy in caring for the patient, because 2 sick patients or 2 sick people equal nobody is getting well. So the first thing that you're going to do is you're going to meet with the home health care team. And usually a couple of days after the patient has been discharged, usually within the first week, you will get a call that will set up the home health care nurses. The nursing staff will come and do evaluation on the patient, whether it be taking their vitals, making sure that their medications are all filled, doing all of that. Now, it's very important as a caregiver that you are in the loop and know what medications that the patient is on and who has prescribed the medications and what pharmacies that they use. Now, some patients will require a lot of medications, some not so much, but having a list of the current medications is a big help. And at some point, medications can shift, where the doctors will take you off a particular pill, they'll up a medicine, they'll lower a dose. It's very important to have a running list of the medications and to keep in contact with the physician that is prescribing the medications. Now, this is where a primary physician comes in handy, because a primary physician will be the one to handle most of the medications and needs to be in the loop of what medications are being prescribed so that he or she are able to prescribe and to refill the prescriptions. Now, I'm going to use my husband's case. I had all of his medications switched to the primary physician because the primary is in charge of his care. Now, if your patient is seeing multiple doctors, you want to make sure that they're all kept in a loop and make sure that they're communicating with one another so that drugs aren't overlapping between physicians. That's a very important part in the recovery process of the stroke patient. Now, my husband's speech therapist has just arrived, so I'm going to stop the video for right now. We'll pick this up later on, and we will go by when home health care teams come to the house. So stay tuned for that.